Hi, everybody. Good afternoon. My name is Pat Nemia, and I am coming to you live from my remote office. But I am with the Federation for Children with Special Needs, and I'm really glad to be with you this afternoon to talk a little bit. The Federation is open, and we are working remotely. We're here to help families, through this time, figure things out, problem solve, find answers. Um, so we're open and available. You can call us, get those phone calls remotely, or if you go to our website and there is an online form and you can fill that out. And that's a really easy way, I think, for a lot of people to get in touch with us. My project at the Federation is called Mass Family Voices. I have a grant that funds my work that is through HRSA, which is the Family to Family Health Information Center grant. So I do a lot of things in the healthcare sector with families, understanding resources, understanding insurance, navigating the healthcare system for their child. And today I thought, considering everything that's going on, we'd talk a little bit about health insurance and what's happening with it and what you can do to make it a little bit easier to navigate the health insurance system. So I'd first start by saying, we all know things are changing so quickly right now. What we say today or what I say here at 2 o'clock might be different at 4 o'clock. So it's really, really important that we stay up on what is the latest information. And one of the things that I have found really helpful is to think about using or listening to the governor's press conference every day. Mary Lou Sutters from EOHHS, who is heading up the command program for the coronavirus, speaks at that. The governor speaks at that, and they usually address the current changes that are going on, either with the health resources, with health services, and also very importantly with health insurance. So it's a really good resource, and those are online every day. So if you can't watch it at 2 o'clock or 11 o'clock or whenever it is, you can Google it and you can watch it later when the kids are in bed or something like that. That's a really good way to get the most recent information about your health insurance. But there is good news right now with health insurance in Massachusetts. If you are on MassHealth, MassHealth has stated that they will be doing no redeterminations in this period. And as long as you were a MassHealth member on March 18th, so you were active on March 18th when they put this directive forward, you will not, your MassHealth will not be terminated or downgraded during this period of time. You may get a letter in the mail because MassHealth, I think, is struggling a little bit. Some letters may have already been processed and they didn't catch them back in time, but you don't have to do anything or respond right now. And this is going to be this way until 30 days after they lift the Massachusetts state of emergency. So that should be a big relief to a lot of people. Um, MassHealth has stated that they will cover all services that are necessary for testing and treatment of the coronavirus. And the Department of Insurance in Massachusetts has directed the insurance companies that come under their regulation to do the same in Massachusetts. There are some companies that operate in Massachusetts that do not come under the regulation of the Department of Insurance, and the Department of Insurance has strongly recommended that they do the same and cover the testing and treatment of coronavirus. And so that's great, and that can be good news for people. Uh, and then, but there are other things that you might be needing during this time for your child, especially things like the therapies. If you are receiving speech therapy, occupational therapy, ABA services, you may need them to continue. And any other services outside of the coronavirus services will continue in accordance with what's in your insurance policy as it stands now. So that's important to know. Um, and so one of the other things I would like to talk about for just a second is people are wondering, what are, services? So one of the things you have to remember with the kids being at home is that children who are on IEPs receive what we call related services at school. They're related to the delivery of that IEP, and they're necessary for a child to access FAPE. And so that's how they're determined and how many times and in what context they're given. outside of school, when people have health services, you know, medical visits, physical therapy, occupational therapy, ABA, speech therapy, those are provided based on a criteria called medical necessity. And medical necessity is based on best practice, right? So um, we know that for a certain condition or a certain situation, physical therapy is going to be able to improve it or increase a person's function. And so that would be the medical necessity. So there's different criteria. So you may say, some people have said, well, but my child got physical therapy in school on their IEP, so why can't the insurance company just give it to me now? And because they're evaluated or determined based on two different systems. And it doesn't mean it won't happen, but it's you can't just simply slide one into the other. So I just wanted to mention that. One of the other things Massachusetts is doing is allowing the delivery of health related and health provided services through telehealth, um, which is very exciting. And while not the same, this is uncharted territory, right? So it at least provides some level of continuity of care for people and for our kids. Um, and I know a lot of people have been asking about it, and some agencies and healthcare providers are up and running. I think doctors' offices are pretty good, you know, in getting their telehealth organized. They do a lot of that to begin with. Um, and so that system seems to be working fairly well. I think the other therapies like PTOT speech, ABA therapies that have never done telehealth before, they're working really hard to make sure that they are being able to deliver these services, that they understand how to deliver them, that they understand how to bill for them so there aren't denials and then they're coming, and then the fallout from all of that. So people are working really hard to get it up and running, and I'm very encouraged that that's coming soon. So how do we put all of this together so that you know so that you're able to get the health services you need during this time for your child? So I wanted to just talk about a couple of tips or ways that you can interact with the insurance companies. One of them is the first thing that you need to do is really read and learn, understand what is it you have. Sometimes people with MassHealth don't even know which type of MassHealth they have, or with an insurance plan, maybe what type of insurance plan they have. Does it fall under the regulation of the state or not? Is it even a state plan? So it's really important for you to kind of have a baseline of what type of insurance do I have. And right now, I think one of the first things you can do, and you can do it yourself, but you can also do it with your older children, when you're thinking of activities for them at home, is to start to educate them on how do you know what insurance is and what's covered. And so insurance companies now, whoever you have, so we have United Healthcare, and when I go to the United Healthcare webpage right now, there's all kinds of information for me explaining what they're covering, what they're doing. Um, even on that page, it says, do you need an advocate? Call this number. And that might be a really big help for us that are people who are trying to navigate the healthcare of their child. So go to those websites and get a sense of what it is they're offering right now, what might be available to you now that your child is home with you. Um, and 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 so look at that, and then have some understanding of what is the mission. What does your insurance company say is kind of their mission or their values or how they serve their customers? Because when you're speaking to them, that's always a good way to frame your conversation with them, is to kind of use their own words. So that's a really good thing. So spend some time. This is something that you can do at night, you can do at a when you have some downtime separate from the kids, that if you're looking for something, that this is something an activity that you can do. And so after you know all kind of this basic information, then what do you do with it? How do you interact with your insurance company? Well, on your cards, right? Get to know your card. Another tip is, make copies of your card, because sometimes I don't know, in our family, somebody's always saying, "Do I have to be carrying a health insurance card?" My kids are older. I'm like, "Where's my health insurance card?" So, in times like this, what we do is we just make copies of cards. Now, for most of your health insurance, you can go online and you can print off a copy and cut it. But make sure everybody has the information that they need in kind of their personal stuff, so that if you needed it suddenly, you'd be able to take it out and hand it to the person that was requesting it. But so I think, um, so now that you've kind of learned and understand a little bit, one of the things you need to think about is what is it that your question is? Maybe you have no questions, but maybe you do. Maybe you're struggling with trying to figure out the telehealth, or trying to, the therapist that you use said, "I'm really sorry, but maybe I'm not involved with this." And so, you need to, the first thing you should do is call that number on that card and talk to the plan. I am happy to help anybody who needs to call. And I know there's other organizations that I'd like to call too out right now. The Autism Insurance Resource Center for families of children with autism help these families a lot with their insurance questions. Um, our other professional partner organization is PAL, the Parent Professional Advocacy League, that helps a lot of families with children with mental health issues. They can help you navigate some of this insurance information. But before you call us, you need to have some information, right? The best thing to do too is have called your insurance company first. Maybe you'll clearly get the answer you want just by doing that. So call that number, start with the person who answers the phone. Have your information in front of you. Know your name, the group number, know who the primary person is on the insurance, and just have your card with you and you can read everything off of it to them. And then call them. Make sure you know what your question is. Also, you want to be as clear as possible. Use specifics. Explain the situation, but know what you're asking for. That's going to get you the furthest and get you the best information. And then, if things don't work with that person, I think it's all about relationship building. Everybody is stressed now. This is uncharted waters for all of us. It's uncharted for the insurance companies, for the healthcare providers, and trying to figure out how to continue care with their clients, and it's and for the members and the families and the children who are seeking access to health care. So building relationships is really important. So if you don't get anywhere with that person who answers the phone, ask to speak to someone else who might have a little bit more information. Do they have a supervisor, or is there a nurse practitioner that helps families with problem solving? Are there client advocates? Are there care coordinators or case managers? And I think if you explain that you have a child with um, with special health needs, that you do need care, help, and coordination at this time, then that might be a very valuable asset to you. So that should be your first path in trying to find out what's going on. And then if you hit problems, then you should call organizations like the Federation or the others that I have mentioned. Um, but the real tip is talk to the people who can help you, and the first person in this line who can help you is your insurance plan. Um, and then, we've talked about building relationships, um, with them. And then I think another really important thing is to keep a record of your conversations. Who did you talk to? What were you told? So that if you do move through and go to a case coordinator, they can help you. Or if you're talking to the healthcare provider who says to you, I'm trying to figure out this telehealth and I'm not really sure, you know, what, um, whether or not I can provide this for you, you'd be able to say to them, you know what, I called my insurance policy and this is what they told me, and this is who I spoke to, and here's the number. And that could just expedite the whole process. So keep good records of the people that you speak to. Um, and then again, as I said, use your resources. Use me, use organizations like the Autism Insurance Resource Center, use PAL, or any of the other organizations, the ARC, that you may be affiliated with to help you if you get stuck in the process. If you're a MassHealth member, you can call the MassHealth Disability Ombudsman. And after I'm finished speaking later on today, I'll put together a whole list of these kind of different resources and phone numbers and who you can try to call. But there's then that's the time to jump and say, okay, I've been working with this and I feel that, I've kind of hit a wall and I'd like to understand a little bit more about this. And then, the other thing to always be sure that you're reviewing and understanding is that when your child's receiving health services, or anybody in your family is receiving health services, you always get an explanation of benefits. And try to spend some time with it and look at it and read it and read if something isn't covered or if it's covered partially and you didn't expect it. What does that say? It says it there. What does it say? And why do you think that maybe that wasn't right or correct? And, so that you're able to then discuss it with the insurance company, or if you have to go to other organizations to help you, you're able to explain it. So explanation of benefits are really important to have and to read and then to be able to share with others, because that it will remove a whole part of the process where you're trying to figure out what went wrong if you look through it and you understand it. So I think I hope these tips help you um, in thinking about how to go through the process of navigating. I think insurance companies, everyone is really trying to do the best they can to make sure that people have health care through this process and that they have continuity of care for their children, for everyone, but for their children. And another issue I know that people are facing is that they are being, that some people are maybe being laid off from their jobs. A conversation that you might have with your HR is if you have a child with medical needs and that's going to be a real burden, you could potentially talk to them about the possibility of a furlough versus being laid off. Because in many situations, if you're furloughed, the company can continue to pay the health care. I don't know how companies feel about this. I know my son's company is going to start with that, and they're going to start by furloughing people. So for at least the near future, people will continue to have their health insurance. Um, but I think that there are opportunities for health insurance that MassHealth is continuing to enroll people. Um, it's going to get a little busy in probably a week or so, but they are continuing to enroll eligible people. And the healthcare connector there's usually, like every insurance policy, there's a time of year that you can sign up for that policy, or in what they call an open enrollment period. So the Health Connector is having a special open enrollment period for people. So if you get laid off, that is something also to look into. If you have questions or issues, you can always, as I said, reach out to me, reach out to other organizations, and we can help you navigate the system. But the state is making things available to people to make sure that everybody has the insurance that they need. So I hope this was helpful to you today. I think, stay tuned in the frequently asked questions section on our website and the resources. We're putting things in to, uh, you know, help people and give them information as it comes up, give them the resources, connect them to places as they need to be when things change, or if we hear something about telehealth, or we hear something about a new directive or bulletin out of the Department of Insurance. We're really trying to get that to everybody. So I hope you all stay well. Thank you for sharing this time with me. And I look forward to seeing you all soon again. Have a good afternoon. Bye-bye.